to our table, and you have equipment that are part of your trade. And we're going to go over some of that equipment. This is called a Vacutainer hub. They're plastic, they're only used once, and then we throw them away. So this is a Vacutainer hub. Your Vacutainer needles look like this. There's always one side that is opaque and has a color. The color usually designates the gauge of the needle. The clear piece is always where the sterile needle is. This is a sterile needle. Now, you'll see that there's a wrapping on this. You always want to inspect the wrapping prior to any type of venipuncture to be sure that it's not perforated or tampered with, right? When in doubt, what do? We throw it out. Also on here, you should have the expiration date. This one says 05 of 2015. This is a 21 gauge, by the way. A 21 gauge needle is typically the needle of choice for most phlebotomists, and the reason being that the gauge of the needle, the diameter, is wide enough so that it won't cause hemolysis of the red blood cells, which is crushing of the red blood cells. And we'll talk more about that. When you prepare your venipuncture needle, which is this is called, there's the opaque side that has a color on it. It's called the hub needle. Now, it's a needle. There's a rubber sheathing on this, and I'm going to pass one of these out to all of you, so that when you puncture the Vacutainer tube, this sheathing pulls back and creates a closed system by which the blood will be sucked into the tube, because the tube is negative pressure. It's pressurized. So this is the hub needle, so it's very sharp, so don't go touching it like this. You take your Vacutainer hub and you put the hub needle inside and screw it onto the threads of the hub needle. And voila. There is your sterile needle, your Vacutainer hub, and then of course these are called Vacutainer tubes, of which there are many. They come in all different colors, anywhere from 3 mLs to 10 mLs. So you have your Vacutainer needle, your Vacutainer hub, and your Vacutainer tube. Notwithstanding is the most important part of the phlebotomist equipment, and most dangerous, the tourniquet. Non-latex. All of you have one on your desk in front of you. Needle gauges, the phlebotomist uses only 3. 21 gauge, 22 gauge, and 23 gauge. Nothing else. You'll never draw blood with an 18 gauge, thank God. And you will never draw blood with a gauge higher than 23. And how do we identify gauges of a needle? Well, the gauge of a needle is always identified on the needle itself, and there are many types of needles. And the best way to identify and help you understand gauges is to show you. For instance, this needle right here is an 18 gauge. This is a syringe needle. It used to be phlebotomists drew blood with syringes. I don't prefer it. There are some phlebotomy schools that teach syringe draws. Personally, I think it's too great a risk because you can easily put air into a vein by using a syringe. And typically these screw onto a syringe like so. Now you'll notice the 18 gauge needle, the diameter is quite wide. It's big, it looks like a huge bumblebee. The needle is rather, it looks like a pencil, basically. The bevel of a needle is the little hole inside. When you draw blood, you always want the bevel to be up, so you can always see the hole inside of the needle, right? So, syringe needle, 18 gauge, Vacutainer needle, 21 gauge, different apparatus, right? So, phlebotomists do not use what? They don't use 18 gauge and they don't use syringes. I'm going to pass these out, let you come and explore these a little bit. Let me show you a 25 gauge. This is orange because it's for insulin. We use this for subcutaneous injections. It doesn't go into the muscle. It goes into the fatty tissue. Ow. Are you kidding me now? Yep, it happened. Am I bleeding? No, I'm not bleeding. I kid you not. This needle bent and went through the plastic.
Oh, wow.
I'm not bleeding. Thank God. Because these are not sterile. This is going to go in the sharps, like right now. But I just want to show you that if you can see, you can't see from there, but this needle actually bent and went through the plastic. This happens. Okay? Yeah.
Had that been
Not
opened
really.
first, or?
Yeah, these are for demonstration. So sharps container. Yes. Let's try again. Okay, syringe. This is a syringe needle. It's also used for insulin, which is why we have the orange cap. All right, I'm going to take this off gently. Always screw your caps off. Never grab them and pull, because what happens is we have a tendency to want to go like this back, and you get a needle stick. Look how tiny that thing is. This is, I want to say 25 or 27 gauge needle.
So lower the gauge, thicker the needle.
Lower the gauge.
Right?
Define
It's
lower.
18.
Yes.
The lower
Yeah.
the number,
Yeah.
the fatter, the wider the diameter, yes. The bigger the number, the skinnier the needle. If you tried to draw blood with this, it would crush the fat, happy red blood cells. It would hemolyze them completely. All of the analytes in your blood sample would be elevated, your sodium, potassium, your chloride, anything that's in the red blood cell will spill out. And they'll send the sample back. You know, it's been contaminated. So these diabetic needles are very small, 25, 27, 29, 30. And while you're inspecting these needles, I would ask that if you do recap them, use the one-handed recapping technique. Never try to cap a needle with two hands. You might miss and hit yourself, right? You never recap needles. I'm not saying recap needles. You throw your needles away. But for the demonstration, if you want to examine them and you have to recap them, do a one-handed recap. Scoop and cover. These are tuberculin needles. These are 27 gauge, and these are for intradermal injections. Have any of you had TB tests yet? So you see how they go underneath the skin, they form that little blib, and they put that fluid underneath your skin. It's kind of cool. We have a little demonstration for that. Again, very small. Subcutaneous or intradermal injections, or we also use 25, 27, 29 for heparin, antithrombolytic therapy, blood thinners, etc.
Are those always clear cap?
Tuberculin, I think. Yeah. Now, the yellow one, I believe this is a 21 gauge, or 20 gauge. This is 21. So depending on who makes the needle. So these are angiocaths for IVs. This is a 22 gauge. When you take IV, if you're in cardio phlebotomy, we go over the gauges that you use for IVs, which can be 18, can be 20, 21, 22, 23. The gauges for IVs differ. You would have to ask the physician or the nurse, depending on what fluid we're using. For intramuscular injections, I usually use a 21 gauge, because typically intramuscular injections, the fluid's rather viscous and thick. And this, if you have a very high or narrow gauge, it takes too long to push the fluid into the muscle. So 21 gauge is usually what I use for injections, but I'll always draw up the fluid first with an 18 gauge needle and then switch. You never give an injection with the same needle that you draw up the fluid with. you dull the needle. I will tell you the truth. One time I was doing a heparin injection on a patient. He was very rotund, and his stomach was very hard. And heparin injection, so boom, in, out, and we're done. I took the needle. Yeah, just shut it off, Ibrahim, thanks. I took the needle and I darted it into the stomach, and the needle bent sideways. I said, okay, we'll try this again later. I was shocked. It's the first time that ever happened to me. In any case, this is a bone marrow biopsy tray that I have here. And we have many different kinds of needles. A bone marrow biopsy needle is quite large. And this is like a screwdriver. I mean, it's really, really big.
Can you verify the gauges? We use the 21, 22, and 23?
Yes, please. Yes.
Not the 18?
No, not the 18. You would never use an 18 gauge to draw blood. And when I pass these around and you take a look at them, you'll understand why. Your people, if they think you're going to draw on them with an 18 gauge and they see it, will run to the hills. Okay? And if you take a look at this, this is really, really huge. So you want to, yeah, we've got lidocaine in here and everything. So you can take a look at this. Very interesting. Okie dokie. So we've got all kinds of needles here. This is a butterfly needle. This is a butterfly needle that around your 15th draw, we're going to have you do butterfly needles. They come in all the same gauges, 21, 22, 23. They're a little bit different than handling a Vacutainer needle and hub. So that's why I don't start my students on them, okay? Because usually they miss the first time. But, these are the most frequent causes of needle sticks for students because they want to grab this and they want to pull. And what's the natural tendency? Boom, come back and stick yourself. And needle sticks always happen on the first day of class, like this. When I'm passing these out and students are opening the needles and they say, oh, I stuck myself. It's like, wash up, incident report. If you stick yourself, I want you to, first of all, I don't want you to stick yourself. Be careful. And if you use the right precautions, you won't. But if you ever do, I want you to wash under hot water and keep pumping till that blood stops. Hot water is going to make blood come out more, and that's what I want. And keep pumping the finger like a snake bite almost, keep pumping till it's all out. You've washed it, you soaped it, you washed it. It takes you 20 minutes, and then we'll bandage it and take care of it. But in a real life situation, if you get stuck, it's a whole different ball field, because then it's life or death, because now we have to find out what that patient has, right? If they've got end-stage AIDS, if they got hep C, the chances are you get their blood and your blood, not a good mix. Could change your whole life in one day. And it's happened to me before. I actually got a needle stick, and I didn't think it was any big deal. My nurse manager sent me down to ER. I was in a jovial mood. I said, hey, you got a needle stick, go down to ER. Okay. Then the doctor in ER put his hand on my shoulder and said, we're going to do our best. It's like, okay. And then they called the infection control doctor who was in Venezuela on vacation, and I got on the phone with her, and she says, we're going to do everything we can. Now my day is just, now I'm getting worried 3 hours later, right? Then I had to wait for the phlebotomist to go up to the floor, draw the patient who was emaciated, who was homeless, who was an alcoholic. So I'm thinking they've got everything now. I'm going to have AIDS, I'm going to have hep C, I'm going to have hep B, and God knows what else, right? For 4 hours, I had to wait. And then they had to do the rapid polymerase chain reaction test to see what antibodies were in the man's blood. He didn't have anything. He had brain cancer. That's why he was emaciated, and he looked so deathly ill. So I'm still waiting on that. It's been about 4 or 5 years. I haven't got that yet. So, but you don't know what's going to happen, right? You have children, you have family, you have people that love you and depend on you. One needle stick can change your whole life. You must be careful.
Yeah, I know that happened with my dad. Took him in once. And when the person came in to take his blood, he jerked. My dad did. When he jerked, the phlebotomist wound up jerking a needle out and stuck himself with the reaction.
Oh my goodness,
So
yeah.
like you said, it was an all-day process. As a matter of fact, they had us come back by cab to the hospital to do another follow-up. on it.
Sure. And you know, I had to go back every 3 months to the hospital to have blood work done. And every 3 months you're thinking, okay, well, hey, why am I still having to be here? Is something going to happen? You know, it's just, it doesn't end. It's a never-ending process. And it's very stressful. So butterfly. So what's the hub needle for? What's the hub needle? What does it do? It punctures the what?
Punctures the Vacutainer.
Yeah, there's a rubber in here, right? The Vacutainer too. So I'm going to have you come up here and inspect these needles. These angiocath needles are kind of cool. These are for IVs. And they're a little bit different. They're longer. This is the flash chamber. And these needles are covered with a plastic sheathing. Well, not hypoallergenic. So that when you go into the vein, you use the initial needle inside of the plastic sheathing to puncture the vein, and then you gently start to push and pull. Push the plastic, pull the needle. Push the plastic, pull the needle. So that the needle itself for angiocaths for IV is only used as a guide. It doesn't go into the vein all the way. And if you pull this thing out, look how long that is. You don't want that in your vein, right? No, instead you want this little plastic thing in your vein. IVs shouldn't hurt. They hurt going in, but once they're in, they shouldn't hurt you. And how do I know when an IV is bad and I have to change it? When someone tells me it hurts and it's red, or if you can't flush it. Usually it's clogged. Could be the phlebotomist who clogged it, right? With blood, hopefully not. Not you guys anyway. So I'm going to have you guys come up and explore these needles to get an idea of the needle gauge.
What would cause excessive bleeding?
Excessive bleeding,
Out of the
IV?
IV, yeah, if they've got it in,
Well, you figure IVs are not like a blood draw. A blood draw, you go in, you pull out your basic coagulation process in your body, closes that hole almost immediately. Because you clot under 50 seconds typically. If someone's on blood thinner, however, they're not going to clot as quickly. So if you have an IV in somebody who's also on blood thinner, that's been in there for a while, you're leaving a hole basically in that area.
so there's where the excess blood is.
And you've got to keep pressure on it for sometimes 15 to 20 minutes, depending, you know. And you can always tell people on blood thinner, usually their arms are all black and blue. And, this looks like a butterfly, is a butterfly, but it's for an IV. Okay, so it's a little bit different. The attachment at the bottom is different. It goes on to an IV tubing, as opposed to this butterfly needle that has the threads that you can screw your Vacutainer hub on. So what I'm going to have you guys do is come up and identify different needle gauges. Please be careful.
I got one other question.
Yeah.
What's a PICC line?
A PICC line is a peripherally inserted central catheter. Usually has to be placed by either a nurse who's certified in PICC line placement or a physician, verified by X-ray placement. It's usually placed in one of the veins up here, typically I want to think Subclavian. And it's usually inserted for long-term therapy. So if someone's going home on antibiotics, and they have to go home and family members have to give them antibiotics, or home care nurse does that, they'll put a PICC line in. We have triple lumen, we have double lumen. So if somebody simultaneously that's getting an IV, I can give them pain medication as well, as long as pain medication is compatible with the IV fluids, because sometimes it makes me nervous. We have a codex, a computer program that shows what medications are compatible. Some medications are not compatible And if you try to give them simultaneously, they'll crystallize. And that precipitate can cause a blood clot or excoriation of the vein itself. So, I'm going to have you all come up and identify needle gauges. So what's the best needle for phlebotomy? Why don't we use a 27 gauge for phlebotomy? What will it do to the blood cells? Crush them like Rocky. Okay, so you don't want to do that. Okay, so your equipment consists of Vacutainer needle, Vacutainer what? Hub, and of course Vacutainer tubes. So I'll give you guys a minute to come up and identify needle gauges, and then we're going to move on to tourniquet time, and I'm going to give the floor to Mr. Ibrahim Shaba. Okay, so let us come on up and identify needle gauges. You can time out on that one. Oh no, that's too much pressure.
With the camera.
Okay, we're gonna let you get ready. You can sit up on a chair. They won't sit here, Dave. Probably. Down.
Can you have a seat? Hmm? I'll identify myself first, or introduce myself. My name is Kim. I'll be your phlebotomist. I've been asked to draw your blood. Is that okay? You're going to want to get their consent.
My name is Susan.
Is that okay I draw your blood?
Yes, I'm okay.
Okay. Can I have your full name?
My phone name
Yes.
313-952-5519.
Your full name?
Phone name.
Your name.
My name. Oh, I'm so sorry. Su Sharada.
And can you spell it, please?
Su S-U-E. Sharada C-H-A-R-A.
Okay. And your date of birth, please.
11-1980.
Okay. I need to ask, then you need to ask a series of questions. And there's a paper here you can refer to at each station. Okay. If you have gum in, I need you to spit it out. Okay. Are you on any blood thinner medications?
No.
Okay. Are you on any blood pressure medication? Are you a diabetic? When was the last time you had something to eat or drink?
12 o'clock. 11 o'clock.
Okay. You did have something to drink though too?
No, I'm drinking.
Yes.
Morning. Yeah.
Okay. Have you ever passed out before?
No.
Okay. Is this your first time having your blood drawn?
Yes. I'm joking. No.
Okay. Her and I have drawn on each other before, just so you all know. When we've come to the Saturday drawing classes, and there's a multitude of people in here, and sometimes you draw on somebody new, and sometimes you draw on somebody you've drawn on before, so we're kind of familiar with each other. But anyways, you still have to go through the questions. Are you allergic
No.
to Lasix,
No.
iodine, or shellfish? Are you in any pain? Okay. Have you had any surgeries on either side of your body? Are you currently on your period? Okay. Do you have...
The tourniquet, after she finds the vein and she ties the tourniquet, she's going to sterilize the area with betadine and then 2 alcohol.
Yeah, one betadine first, then 2 alcohols. And you're gonna start from the inside and make a swirl motion to the outside. You don't wanna go start in the middle and then go back to the middle. You're gonna go and then around with all 3.
Yep. And why do we clean with 3? Because we want to sterilize the area we want to clean the skin as much as possible, right? To prevent any needle sticks. To prevent any kind of infection.
I'm gonna put the tourniquet on to check her vein, and then I'm gonna release it before I glove up.
So next week we'll have, we'll check them off and then probably get them ready to draw blood.
Is it too tight? Okay. She has really nice veins. So, she has a beautiful one right here in the middle, and that's the one I'll
Thank
go
you
for.
very much.
It is beautiful. So, I can see it clearly. I'm gonna take this off.
Yes, what's the question? Go ahead.
Can you only go off when you ready to start blood? Can you only go off site, or you also have to feel too? Where you feel it for, or you just look and see if you see a thing?
Oh, no, you have to feel it.
Oh, yeah, what is it supposed to feel like?
What does it feel like? It feels,
Kind of a
Yeah,
spongy.
sometimes, yeah, you have to feel
Must
it.
have-
We're going to show you. Because then you're going to be able to feel each other's veins. You'll feel mine, and it feels everybody's in class. They feel kind of like a, like spaghetti,
Yeah.
like cooked spaghetti.
Yeah, does it?
Al dente. I gotta compliment you, Miss Kim. You're doing such a nice job of explaining.
Oh,
It was very nice. I love it.
Good.
Yeah. Okay.
Yeah, I'm scared.
you? My patient doesn't like needles. I'd be very gentle. Okay. Okay. Close your, make a fist. I can feel it again if I want because I haven't sterilized it yet. It's right there. Once I've sterilized it, I can't retouch. Okay, so I'll start with the betadine first, which is messy. Start here in the middle, and then make a big swirl around. Same with the alcohol, 2 of them. Just like that. And then you're going to want to let it dry. Otherwise it'll sting.
You don't blow on it, by the way.
Right, don't blow on it.
Don't fan it, don't blow on it.
Not them either. So then I ask her, let me know when it's dry. Okay. Then I gently pull the cap off, bevel up, and I'm going to anchor it, but not close to where I sterilized it. And just go in gently. Put my tube in. Up. There it comes. Release the tourniquet Take the tube out, invert. Pull out and press.
Woo, good job.
And then immediately put your needle and hub in. Here, honey. Hold, put pressure in the sharps container.
Only sharps in the sharps container, everyone. No paper, no gauze, no gloves, right?
You only need a flash of blood. You don't need a whole bunch of blood. So as soon as it comes through, you can take it out.
Yeah, what do you do to soup? You throw that in the,
Yeah, that goes in the sharps. Absolutely, all the
Because that's
blood.
on biomass.
It is, yes, you're gonna throw that right in the sharps. And you're gonna make that nice little pressure dressing for us.
Mhm.
We like to take people up nice and neat, not like Frankenstein. Put them together.
Just fold it into like a small pillow, and then you need just a piece of this tape. Let me see. Okay. Put your finger right there.
Very nice job.
And you said one arm per day?
You can do up to 4 draws a day.
4 draws per day.
So you can draw on 2 people, each have 2 arms, that's for
Okay.
4 days. But you can only, once you draw on one arm, you
You gotta
can't
go
draw
with
on
the
it
other.
again.
Okay.
Nice technique.
And
You're,
then,
you're working pretty good on your pressure there, Miss Ken.
and then just clean up your area.
And what else is she gonna do after this?
Wash your
Wash
hands.
your hands. Yes, we did hand washing today, so.
Okay. So do you want me to go ahead with your other arm? Are you, okay, since you're already there?
Okay, we gotta,
Do I need to have her re-get up and re-wash the chair and,
well, not the
No.
chair, but you're gonna have to take your gloves off and wash your hands all over.
right,
Yeah.
but do I need to clean my area again?
You should clean your area, yeah.
Okay.
Please.
And just be aware that if they bend their arm like this, it could leave a bruise.
Yes,
I mean, it'll go away after like 3 days to a week. But if sometimes they think, oh, they did a bad job, you should sort of make them aware that when they bend their arm, that it can also
let me
leave a bruise.
re-clean your area.
It was just a little one, nothing big.
We're gonna let you guys go ahead and draw. I wanna thank you.
Thanks.
We're gonna start in on tourniquets now, and
Never had a tourniquet.
Oh, never.
Okay, all right. So tourniquets are our first tool for phlebotomists. It's very important and it could be dangerous. All right, if left on too long, more than a minute, it could cause permanent damage. Okay, we in the hospital they also use tourniquets for amputations. Okay, if you leave it on too long, if you leave it on for 3-4 hours, then they're good for amputations. All right, so we don't want to do that. Now, can I get a volunteer? Come on up. You might have to take off your coat because we need your arm. Yes. All right. Tourniquet time. Let me get one arm. You want to? Okay. I just sit on it, if you want. Now, what you need to do is you need to go 3 fingers above the antecubital fossa. All right? Is it fossa or fossa?
Fossa.
Fossa.
You
Okay.
say tomato, I say tomato.
All right. So you put it like this. You don't want it to roll up. You don't want it. You don't want it like where it's like that. All right, because it can cause even more pressure. Okay, and do more harm to the patient. So you want it flat onto the arm, and you just cross them. Just make one side tight. Don't make both sides tight. Just one side, and just put a little bend in there. That's all. All right. And then after you do that, just wait like maybe 30 seconds, and the vein should pop right up. Alright, and you feel for the vein. I can see 2 veins here, but you can't use your visual. Alright, even though I can see it, you also need to feel it. Alright? I can feel this vein over here. Anybody want to come up? You guys want to come up and feel? We got 1 minute, so we're good. No permanent damage right now. Go ahead. Go ahead, feel for the vein. You feel how it's a little spongy? Try to feel here and then feel over here. See how there's a difference. Yeah, but you can feel that one, right? If you can identify the vein, that's all you need.
Press
you're right,
down.
this one.
Gotta
Yeah,
pop back.
that one looks, yeah. Do the one that you're more comfortable with, alright?
Funny.
You want to come up?
Get down.
Should be fine. I didn't tie it too tight. Is it hurting you or anything?
No, I'm fine.
Okay. You want to feel your own vein?
I was practicing like a week ago.
Okay. Alright, now we tied it like this, okay? We just made a little bend here. So when you want to pop it off. Oh, I'm sorry.
I don't feel like that.
Let me try the other arm. So when you pop it off, you can just pop it off by pulling it. Alright? There we go. Go ahead. You might feel the bacillic. I can see it over there, but you don't want to feel for it. Can you feel it? It feels a little spongy. You can differentiate between the rest of the arm and where the vein is. Okay, if you can't find that on one arm, we can do the other arm again. All right?
And do I feel comfortable?
Now I want you guys just grab a partner and practice tying your tourniquets. And I'll come around and inspect.
Ibrahim, when you get done with hers, I'm gonna have you tie a tourniquet on my arm for the
Okay.
camera. I think they'll maybe, you can see my median cubital
So we just-
without even a tourniquet actually.
Bouncy, bouncy.
Thank you. Take your tourniquet and grab a partner and practice.
Ibrahim, you can come over here and tie a tourniquet for me for the camera. And I'll come over here and just step
All right.
over here. Okay, everybody, you want to see him tie a tourniquet again? You can watch. Okay, go
Okay,
ahead.
so we go 3 fingers above the antecubital fossa. All right, so over there. Then you can't see it, right? So you have to feel for it. You can feel one right there. You can sort of feel one right there. Do you have a bifurcation?
Oh, yeah, I do.
Oh, we forgot to discuss bifurcations.
Okay, we can do
All
that.
right,
They can
cool.
practice. Let me try this arm. I
Okay.
think this, you might be able to see this better. I don't know. But go ahead and try this arm. So see how he does the tourniquets? He pulls, keeps them straight. The ears of the tourniquet should point upward.
That might be a little bit too close. I'd want it a little bit
No,
higher.
no, you're fine.
Okay.
See if you can feel
Yeah,
that.
she's pumping her hand because
I want the vein to
Yeah.
pop out a little bit. You don't.
Do you palpitate and
Oh no.
Palpate,
you
yes.
palpate, but you don't pat. You press.
yeah, I can feel this one.
You feel that one?
And
Yeah, 'cause I've had
I'm not sure what that is. Could that be a tendon? Feel that.
Actually, the veins are superficial on top of the tendons typically, but that medial cubital is a little bit more narrower than the other one. So yeah.
Is that a vein?
Uh-huh.
I
Yeah, that's
feel a
a,
little harder.
yeah, it is. That's a vein.
Okay.
And the tendon is here on this side. So if you press real far down, you can
Yeah.
feel the tendon.
Okay.
So good. Good job.
All right.
Okay, so we're going to practice tying tourniquets right now. Everybody's going to come around and watch you guys. So time out on this while they,
Though sometimes you might not feel the vein, right? Sometimes it could be a cold day. Okay? You just can't find the vein. What you need to do is, you need to understand your veins first, okay? We have two sets of veins. We have veins that are superficial, okay? They're on the outside, they're really close to your skin. And we have veins that run inside your arm, okay? Now on a cold day, these veins tend to get smaller. Okay, why is that? Because your body's trying to protect all the heat that you got, right? So it tries to run from inside. And when it's a hot day, it does the opposite. Your body actually releases heat through your blood. Okay? So the veins on the inside tend to constrict, and the veins on the outside tend to get a little bigger. Okay? So one thing what you could do is you could get a hot rag, not a hot rag, but like kind of warm, okay? And put it on their arm, and that will simulate, like they'll try to release more heat. So the superficial veins will get bigger, all right? Also another thing that does that, anything that could overheat your body, like working out, also tends to do that. You tend to see your veins a lot better when you're working out, right? Yeah. So we take a somewhat hot rag, all right? You put it on yourself first, to make sure that you don't want to burn the patient, okay? But usually I think they have them in like a refrigerator type heater now.
well, those are blankets. If you're whatever he was talking about, he's talking about using the warm rag technique to bring out the difficult veins that are superficial, that are narrow, that you can't see. So you just take a warm rag under warm water, squeeze it out, hold on to it, press it on the patient's antecubital fossa while the tourniquet is on, have their arm at their side, leave it on for about 40 seconds. I know your tourniquet's going to be on almost a minute, if not longer, but at least it'll give that out, then you can release it. But it'll give you an opportunity to see the veins start to come to the surface. And it really does make a difference. I had someone in ER show me that one. So the warm rag technique, and I like what Ibrahim said about making sure it's the right temperature because you don't want to burn someone. But as I was saying, in the hospital, the chances of you finding hot water, slim to none. So, but yeah.
Okay, so we have that, and we also have where you let gravity help you. Okay, so where you put your arm down, and that can also get the vein, get the blood more around where the vein is and make it a little bigger. That also works. All right, now we're just going to practice more tying tourniquets, then we could go home. All right?